Hello, my name is Yomaries Villegas. I'm a nurse practitioner student, and today we will be doing a general survey as well as a head, ears, eyes, nose, and throat exam. I've washed my hands, and I'm ready to introduce myself to my patient and get started. Good morning, my name is Yomaries Villegas. I'm a nurse practitioner student. Can you tell me your name and date of birth?
My name is Jacques Smith. My date of birth is 3/16/97.
All right, Mr. Smith, what brings you in today?
I've been having headaches and lower back pain.
Okay. When would you say that's been started?
The headaches been like the last couple weeks, and the lower back pain has been on and off for several months now.
Okay. What are you doing for your headaches and your lower back pain?
I just take Tylenol for them when they do flare up.
Okay. How often do your headaches last?
Maybe like 15 to 20 minutes.
Okay. And Tylenol is the only thing that makes them go away?
Yes.
Okay. What about your back pain?
Yeah, Tylenol is the only thing that will help it, and less running.
Okay. Alright. Do you have any other kind of past medical history? Any recent diagnoses, surgeries?
I had rotator cuff surgery.
Okay. When did you have that done?
Maybe a year ago.
Alright. Any complications with that?
No.
Okay. Any hospitalizations?
No.
And you're up to date on all your immunizations?
Yes.
Very good. Do you have any past medical history or family history that you know of high blood pressure, diabetes, or cancers?
No.
And socially, do you do any kind of smoking or tobacco products?
No.
Any illicit drug use?
No.
What about alcohol?
Yes.
Okay. How often do you drink?
On the weekends.
Okay. And when you do drink, how much do you drink?
3 to 5 beers.
Okay. What's your diet look like?
Lots of proteins, rice, pasta, fruits and veggies, and occasional desserts.
Okay. Do you exercise?
Yes.
How often?
5 to 6 times a week.
Okay. Do you have any allergies, Mr. Smith?
Just seasonal.
Okay. No food?
No.
No drug allergies?
No.
Okay. What about any medications besides the Tylenol? Anything prescribed or over the counter?
Zysol.
Zysol? Okay. How often do you take it?
Daily.
Alright. And do you know the dosage?
No.
Okay. Alright. Any other complaints, Mr. Smith? Any skin changes, vision changes?
No.
Any changes with your appetite?
No.
Any hearing changes?
No.
Weakness?
No.
Joint pain?
No.
Any thing that you've noticed with your emotions or anything like that?
No.
Alrighty, well I'm going to go ahead and get started on your examination, okay? First thing I'm going to do is look at your head and face. I'm going to make sure that there's no lumps, bumps, or lesions on your head. And it looks good. I'm going to look at your face, make sure that it's symmetrical. There's no bumps, bruises, lesions, or anything like that. Alright, now I'm going to go ahead and look at your eyes. I'm going to look for any redness, any discharge, or any edema, and they look good. Okay. I'm going to ask you to clench your jaw for cranial nerve number 5. Very good. Equal. And now I'm going to ask you to close your eyes. I'm going to touch you with something sharp and touch you with something dull. You tell me whether it's sharp or dull, okay?
Dull.
Good.
Sharp.
Good.
Dull. Sharp.
Very good. Cranial nerve is intact. I'm going to ask you to smile for me. Puff up your cheeks, frown, and raise your eyebrows. Very good. Cranial nerve number 5 is intact. Cranial nerve number 2, I would have you look at the Snellen chart and tell me this, read out the smallest letters that you could. And now I'm going to look at cranial nerve number 3. I'm going to have you look straight ahead, and I'm going to shine a bright light in your eyes, okay? Very good. Pupils are equal, round, and reactive to light. Cranial nerve number 3 is intact. Now I'm going to have you cover your one eye, and I'm going to have you tell me whether it's your right or my right or my left hand that you see wiggle.
Right. Left.
Okay. Cover your other eye. We're going to do the same thing.
Right. Left.
Okay. Very good. All visual fields tested and intact. I'm going to look at your nose. I don't see any discharge, no bruising, no bleeding, airway is patent and it's symmetrical. I'm going to look at your ears. I'm going to look for any discharge, no discharge, no edema, no redness. Very good. I'm going to look at the same thing on your other ear. No edema, no redness, no discharge. Okay. I'm going to have you close your eyes. I'm going to reach behind you and you tell me which side you hear this on.
Right, Left.
Very good. Cranial nerve number 8 is intact. Now, Mr. Smith, I'm gonna look at your mouth. I see your lips are pink, they're dry, or pink, they're moist, and they're intact, no lesions, no skin cracks. I'm gonna look, I have you open your mouth. I'm looking at your teeth, no missing teeth. Your gums aren't bleeding or anything like that. Your tongue is moist. I'm gonna have you stick your tongue out and say ah. Very good. Uvula rises on pronation. Cranial nerve number 9 is intact. I'm gonna have you stick your tongue out and wiggle it side to side. Very good. Cranial nerve number 12 is intact. I'm gonna touch here and I'm gonna ask you to swallow. Very good. Cranial nerve number 10 is intact. Now I'm gonna feel your lymph nodes. You're gonna feel in front of your ears, behind your ears, and down your neck. Preocular, postocular, occipital, superficial cervical, deep cervical, posterior cervical. I'm gonna have you shrug a little bit. Very good. Supraclavicular. Alright, I'm gonna place my hands right here and I'm gonna have you shrug your shoulders. Very good. Cranial number 11 is intact. I'm gonna place my hand right here and you try to push against it. Very good. Push. Very good. I'm gonna have you move your head up, down, side to side, all the way around. Nothing hurts, no tenderness.
No.
Alright, very good. Okay, I'm looking at your trachea. I feel that it's midline. There's no shift or anything. Okay, looks very good. Alright, Mr. Smith, all your cranial nerves are intact. Your lymph nodes feel fine. There's no other issues that I've noted. I'm going to go ahead and sit and document all these findings. And if you have any other kinds of problems, you don't hesitate to call back, okay?
Alrighty, thank you so much.
You're welcome. Alright, my name is Yomaries Villegas. I'm a nurse practitioner student, and I have completed my general survey and head, ears, eyes, nose, and throat examination. Thank you.